The Ministry of Health on Tuesday commenced a 3-day consultative workshop on the selection and development of health benefits package to be provided by National Health Insurance. Disease area experts and stakeholders are invited to take part in the selection and development process for the health insurance scheme. In his opening remarks, the Minister of Health, Dr. Amadou Lamin Samata, says the essence of the health insurance is for Gambians to get universal health coverage.
As we say, health is a human right, but it's a human right that is expensive for countries, especially low-income countries. But of course, government insists that quality health services must be provided for the people. In our efforts to get to the Sustainable Development Goals by 2030, universal health coverage being amongst them, we think the health insurance scheme is a must.
He adds that the government is highly committed to sustaining the health insurance scheme.
That the government of the Gambia is highly committed to the sustainability of this scheme. That is why government has actually committed a whole lot of resources, including revenue from the tobacco tax, revenue from coal termination, the telecom coal termination, revenue from the Senegambia Bridge. Percentages of these revenue sources will be committed to the National Health Insurance Scheme. So at the end of the day, government's total contribution to the National Health Insurance Scheme or to health in general is likely to be above the Abuja Declaration of 15% from all these sources.
The chairman, National Health Insurance Scheme, Melvi, says the initiative is going to be a game changer in the country in terms of health service delivery.
But let me say that the NHIS is going to be a game changer in this country in terms of health service delivery. First of all, you are now going to ask people to pay a premium for the services. And when people pay a premium for certain things, they expect services to be delivered. People will demand for services. People will demand for quality. People will complain on the press. People will go onto the internet. They will write and talk about it. And roles and responsibilities will have to change because the stakeholders, Ministry of Health itself, that is the custodian of the health of the country, will now have that more important role to make sure that even the NHIS is there to deliver services, but no country can sit down and see the health of the population going down.
The World Health Organization country representative to the Gambia, Desta Truni, gives some of the challenges of the health insurance.
The National Health Insurance Scheme is it's a difficult choice that we have to make to deliver the essential services to the majority of the people as much as possible. So whatever choice we make, there is always an opportunity cost. If you have used this money for this, then it means you may not be able to use that money for some other services. So you have to leave something. So it's difficult. That's why it's difficult. Although you would have liked to have all the services delivered, but it's not possible because resources are limited. So that's the reality. So that's what makes it difficult.
Director of Health Services, Mustafa Abite, had this to say.
Whatever we do here is going to reflect the common man in the Gambia, and we should all give it our best to ensure that the outcome is very responsive to the needs of the country. We want to end by thanking the Honorable Minister for the support and the Minister of Finance also for the support they've given. It has been said many times that it is in few countries where you have the Minister of Finance and Minister of Health working so closely to provide national health insurance. Usually, the Minister of Finance is usually saying, no, this is too much, it's too expensive, you are taking all our resources. But in Gambia, we have a very cordial relationship where the Minister of Finance is working closely with the Minister of Health to ensure that we have this national health insurance. It's a unique situation, and we all need to capitalize on it and make sure that we deliver to the Gambian people.
The goal of the workshop is to answer the list of interventions currently provided in the Gambia. They include the coverage and quality of interventions provided, interventions or services that are not currently in the essential healthcare package and should be considered for inclusion among others. Reporting for Kerr, Fatou, I am Fatou Silla.